Okay, so hi everyone, my name is Tikis Mackenzie, and the title of my presentation is Methotrexate as a chemotherapeutic drug. So methotrexate is used to treat acute lymphoblastic leukemia in children, and it does this by inhibiting dihydrofolate reductase, which is an enzyme, through competitive inhibition. And basically what it does, this drug basically binds to the active site of the dihydroxyfolate reductase, and this binding causes it to become inhibited. So the intermediates of usually folate would bind to the enzyme and it would produce some downstream intermediates, and these downstream intermediates are necessary for nucleotide synthesis. However, because the enzyme is inhibited by methotrexate, DNA replication is impaired. DNA replication and repair is impaired because you don't have these nucleotide synthesis, and this basically triggers cell death, and it also eventually reduces cell proliferation. So from an analogy from the textbook, so we know that when DNA damage occurs, it causes the activation of p53, which eventually leads to apoptosis. So p53 basically activates PUMA, which inhibits BCL2, and BCL2 inhibits apoptosis. So when BCL2 is inhibited, apoptosis occurs. So this is what the drug induces in cancer cells. So the pathway that the drug acts on is basically DNA synthesis. So in cancer cells, we know that DNA synthesis is occurring at a very fast rate. Therefore, this shows that the enzyme that leads to the production of these nucleotides is very active, and this enzyme is the one that is inhibited by the drug. So dihydrofolate reductase is inhibited, and this leads to reduced DNA synthesis, and eventually reduce DNA repair in cancer cells. So in normal cells, this pathway occurs at a normal rate per se. However, in cancer cells, the folate cycle is overactive. So this drug actually reduces how active the folate cycle is and leads to less DNA repair and eventually cell death. So there are several side effects of methotrexate, as it is a chemotherapeutic drug. These involve inflammation of the mouth, lips, nausea, tiredness, headache, blurry vision, leukopenia, which is reduced white blood cell counts. And these are basically because methotrexate, it targets fast dividing cells. So these are cells in your blood cells, epithelial cells. So if these cells can't divide fast, or they're inhibited from dividing, this basically leads to less repair of those tissues and eventually less division of those tissues, such as the white blood cell. So because methotrexate targets cell division, or cells are dividing fast, it leads to these side effects. So my question is, since so many oncogenes have been identified, why is drug treatment the main focus of treating cancer instead of gene therapy? And these are my references. Thank you.